Welcome again to another installment of the Mwanangu Mtanami podcast. We are here today sharing a very exciting topic, and wow, I feel honored to be able to talk about this issue because it's such a topical issue amongst women. And we've got here as our guest Dr. Vita. Yes, if any of you have been watching social media, she's like big on that space. And then we've got a friend of mine, Gladys, here to share her personal story talking about fibroids. So maybe we can just hear a little bit about the both of you, and then Gladys will get into her story.
Well, hello. My name is Dr. Vita, and I'm so happy to be on this platform. Thank you so much, Jenna, for inviting me. I love talking about women's health. I love talking about fibroids, PCOS, infertility, irregular periods, all of those things. And I'm a part of the discussion in women's health, and I'm here to bring solutions. And so I help women on a one-on-one basis with these issues, and then I also help women through education via my various social media platforms. So it's my pleasure to be here to talk about this topic.
Oh, I'm so excited to have you here. Thank you for coming. Gladys?
Hi, so my name is Gladys Chiwaya. I'm a mom, stay-at-home mom pretty much, and I'm just here to share my experience with fibroids and hopefully learn how to manage myself better because I do understand there's a whole lot I could do to help myself and just basically shed light on what to expect or maybe just help the next person just realize what they're going through is practically common amongst women because I think a lot of people don't discuss this issue, especially here. It's sort of close kept. So I'm here to just share pretty much. Excited to be here. Thank you for having me, Jen.
I'm excited to have you here, and thank you so much for taking the time to share your story. So we'll just get right into it, Gladys. Please tell us your experience with fibroids.
Okay, so right now I'm 32, going on 33. So I've had a long journey pretty much with fibroids. I first found out that I had fibroids, um, 2008, early on in 2008. Before that, I think 2007, I just had pain at my pelvis. This was in my first year in university, but strangely enough, I had never heard of fibroids before. So I'm in uni first year. I'm in pain, and I sort of kept quiet about it because I thought it could be many other things. I used to take painkillers, but the pain would not go away. So 2008, I noticed I'd go my period, but it would not end smoothly. So I looked for help. I think I went to see a doctor. They gave me some pills that helped to stop the period after a couple of days. Maybe it was like 2 weeks of nonstop bleeding. So I got on medication, but I think this lasted for a couple of months, and then the pain intensified. It really got bad to a point where I couldn't function. It was really bad. So I went into theater, like it must have been a weekend, got into theater, and unfortunately, the doctor then did not go through the proper diagnosis, the procedure he was supposed to take anyway, and he thought it was appendicitis because the symptoms surprisingly resembled an appendicitis. So I had the surgery, and interestingly enough, the symptoms got better after the appendicitis situation was resolved. So I did another month, and then the bleeding started again. And it was proper hemorrhaging. I would soak maybe a heavy tampon, and a heavy pad. And every 2 hours, I would need to change my tampon and change my pad as well. Sometimes I would spoil my bed, and I was very young at the time, so all of this was very traumatic for me to understand what's really going on and not have answers. So I then got referred to another gynecologist, who then had me take a series of tests and scans, and then, sure enough, it was fibroids. So I had the surgery, the first one in 2008, and that was great. After that, I managed to go back to school, and everything was fine for a couple of years. Then I got married soon after university. Couldn't get pregnant. I didn't understand what was going on. I had about 5 years of absolutely no conception whatsoever. So when I then went and had scans done, that's when they found out that the three fibroids pretty much came back exactly as they were from years back. And this is 5 years later, and I got onto a series of medication and stuff, trying to help, trying to be better, eat better, exercise, whatever that I could find online. But it didn't really help much until I heard of this. I think it's Forever Living. It's an aloe vera based product that they market here. So I tried that, and I got pregnant successfully. But I think I had about maybe significant pregnancies that I carried, like maybe 4 or 5 months more than that. Maybe I had 5 losses, 5 miscarriages, or 6. But in between, I lost, I don't know how many times. It actually became a joke that pretty much every month you get excited, I'm pregnant, and then a couple of weeks later, you lose your baby. So that was a lot for me. Mentally, I sort of lost it. I got into depression because I didn't understand really truly why this had to keep going on, especially if I was making so much effort to feel better, to do better, so I could carry to term. So pretty much had to have surgery, but just when I was about to have the second surgery, I then realized I was pregnant again. So this time I had a difficult pregnancy because the pain itself that would come with being pregnant was actually not bearable. I think it was 2 weeks of excruciating pain. I couldn't move, I couldn't eat, and you're pregnant. You want to eat, but the pain was just too much for me to bear. And I had given up. And then they gave me some medication that I used to import every single week. And then I had to have surgery in between because my son actually tried to come out because my uterus couldn't contain him for that much. But I had surgery. What do they call it when they tie you up, when they tie your cervix? Doctor, maybe you can help me. They put in a
I'm not
stitch
giving
basically.
any. Just go ahead and tell your story. It doesn't matter.
But yeah, they tied my cervix at some point. It must have been 23 weeks. And after that surgery, the symptoms all subsided. I don't know how and why, but they subsided. And I managed to carry my son to term. So I have that one son of mine. His name is Taponeswa. He's a great boy, healthy, everything is perfect. Fast forward a couple of years in, I want to have another baby. And I think that is when things got really bad for me because I got pregnant again on the same aloe vera products that I was taking. And then I carried to about 4 or 5 months, they about, and then I lost the baby again. So when I then went for the scan to find out how bad my situation was this time, that's when they found that they just had multiple fibroids. They couldn't count them at the time. And they were literally everywhere because I know they're different. Some of them are outside the uterus, some of them inside, and they name them differently according to the position. So I had multiple. And then they were like, you need to have surgery before you consider trying again. So I then had the surgery. And unfortunately, I think the doctor said he stopped counting when he got to 25. That's what he said. But I had a whole bucket full of fibroids, shapes and sizes. They were huge. It was literally a 20-liter bottle, a bucket full of fibroids. And they were all inside me. The biggest thing for me was how did I have all of these things inside of me? But yeah, the surgery I would have thought went well, but that was a botched situation. And so maybe that's not part of it necessarily. But I think the major thing was the fact that I lost from the fibroids, I lost one of my tubes. It basically broke off from the weight. So, and the doctor said that at the time that pretty much it must have been like that for years and I didn't know. So I probably conceived on each time I was conceiving using the one that I still have now. So I lost that one tube, and so I'm functioning with the one. And yeah, because I've had to have surgery again after that myomectomy. I had to have another surgery because my uterus had been through too much. So I've had a laparotomy after that, and so I'm basically healing. But since the fibroids have been removed, I have a regular flow, the lightest I've ever had, even since my first period ever in life. So I'm happy about that. And yeah, life is somewhat normal, I guess. I'm just probably
Wow.
scared that they might come back. That's my biggest thing. But all
So,
the
Yeah.
same, that I
so,
think that's about it.
so thank
I
you
don't
for
know if
your
you have any
story.
questions.
Your story is going to help a lot of people. The procedure that you were talking about is we call it a cerclage, where they
Okay.
go in and then they sew up the cervix. There's different terminology all over the world for that, but
Okay.
here that's what we call it. Thank you so much for telling that story.
You're
I know
It's
a
welcome.
lot of people
amazing.
can relate.
Yeah, I've got like chills. I'm like,
Mm,
wow, one person going through all of that. So thank you so much, Gladys. And I think a lot of women in whatever various forms can relate to what you're sharing as well. And the beauty about this is it can also help someone start to think about whether it is they have them or not. And now we're going to get in with Dr. Vita just talking about the fibroid situation. What are they? really? What are fibroids?
So fibroids, we can get into the types later on, but they're essentially a ball of your cells that have outgrown their space. So all of our tissues, all of our body, from our brain to our liver, these are all cells. So our heart, these are all cells that perform functions for us. And so what happens with a fibroid is you have a cell or even multiple that decides that it wants to grow and multiply and multiply and multiply. And so you start to have like that one cell will be releasing some collagen and other structural proteins. So it just becomes a ball of cells that are tightly knit together. And they can be all over the uterus.
All right. So like what Gladys was saying, some are inside, some are outside, and all over. Okay.
Yeah.
Wow. Scary. So what causes them? What causes these cells to just keep growing and wanting to do what they do?
So it's hormones. So they are what we know is they're dependent on estrogen, progesterone. And so what is thought is, for some strange reason, a woman starts to produce more of those, and then that's what then causes the fibroids to kind of go out of control. So that's as much as we know. There isn't a whole lot out there. There aren't really a lot of people studying it. I always like to say I work at one of the best medical centers in the world, and not a single person studies fibroids. So there's a long way to go in terms of figuring out exactly what's going on. But we do know that it's a collection of a bunch of cells that are dependent on estrogen and progesterone.
Okay. Is there a specific type of person, who is predisposed to having these, or culture or something? I mean, where are they commonly found?
Black people. So Black Americans, Black Europeans, African Americans, whatever. If you're in Africa, we're starting to see more incidences of it all throughout the continent of Africa. So we know that definitely if you are Black, you are predisposed to them. Secondly, if you're obese, you're predisposed to them. Those are the top two indicators that we have so far of people that tend to produce lots of fibroids. But then you have some person who isn't Black or who isn't obese that has them. Or you also have someone who is small and Black, and then they'll get them, and they'll get lots of them. So there's a lot that we don't know.
Okay. All right. So you've talked about the people who typically get them, right? So what is it? What could it be that's unique about these specific people? Is there something within our genetic makeup that makes us more susceptible to them, or it's just fluke?
I always said until a couple of years ago that I thought it was food that was contributing to that. But then I look at some cultures in Africa who eat an organic diet, and we're getting women that are getting these fibroids. So my guess, this is just my personal guess, is that birth control is playing a role in this. Because if you look at kind of when the birth control, people getting prescribed and put on birth control started, and then when we started to see these reproductive issues, it's kind of around the same time. So maybe it's a combination of food combined in there with these birth control. I mean, because birth control, you're getting synthetic estrogen, you're getting synthetic hormones put in you. So just logically, that makes sense. But like I said, it could also be skincare products that we're now using. Everyone is obsessed with makeup. Some people are obsessed with bleaching their skin. That could contribute to it. I mean, there's just so many things that we're exposed to that it's so hard to eliminate one thing. But I have noticed that the people that they eat an organic diet, that maintain a good weight, and that don't put a lot of that makeup and toxic products, from my experience, tend not to get the fibroids. But I don't have a big enough sample size to conclude that.
Okay, it would be interesting to get into the research and discuss that one further. So, what is the life cycle like of a fibroid? like from beginning? Does it end? What happens with it?
Yes, it does. So initially, it's that one cell or even more, but it can only start. It can start with just one cell that decides to malfunction. And so
Mm-hmm.
then it's stimulated with that estrogen, progesterone, and then it starts to multiply, multiply, multiply. Then, as they're multiplying, they start to release a structural protein or multiple structural proteins. I mentioned collagen. So we all talk about collagen in terms of our skin looking good and tight, but basically collagen is a structural protein that helps to hold things together. So
Okay.
even like for women that have a baby, then they get stretch marks and things like that. Collagen is the one that helps to bring everything back and tighten everything up. So the cells down there produce that. And so that's what makes the fibroid a ball. And
Mm-hmm.
then once the fibroid gets to its end, like this is it, it means that the blood vessels are not going all over the ball. So think about, you have like this kind of almost hard ball. And so there's not enough blood vessels. There aren't enough blood vessels throughout for the blood to go through and give nutrients to it. So what happens is the cells in the center that aren't getting the blood flow, they start to die. And then before you know it, the entire fibroid will have a bunch of dead cells just because there's not enough blood flow that's going down there.
Okay.
So think about how taxing that is. As a normal woman, let's say you're 150 pounds, you have normal blood flow, but then you start to have this big ball that's forming and it's draining you because it's sucking all the blood down there. So you have to start making more blood. And so now there's more blood down there just because you have more cells. And so at some point, it gets to a point where your body cannot do it anymore. It cannot continue forming new blood vessels down there. It cannot continue sending nutrients through the blood down there. And so they die.
Wow. Now, I know the body has a natural process of getting rid of dead things, right? Can they then just disappear or they have to be removed?
Usually, once it gets to that point, it's so big that that's too
Yeah.
much for the body to remove. And then the problem here is then you'll get calcification. And so what that means is once the cells are dead, they start to release the calcium that's inside. So all of our cells have calcium in there.
Mm.
Calcium is what allows our heart to pump. There's a small amount of calcium in all of our cells. And so if one cell dies and the calcium is released, that's not a big thing. But if you've got a big collection of cells that die and they're releasing calcium, that makes it hard. Think about calcium. Your bones are made out of calcium. And so if
Yeah.
you have a big ball of cells that die and release calcium, then that fibroid turns into a hard ball. And that's impossible for the body to get rid of a hard ball this big. I mean, you have some people that have fibroids as big as my head. So that your
Wow.
body cannot eliminate that. You would have to surgically remove that.
So you mentioned the issue of there's more blood flow down there in order to feed this thing. Is that what causes the heavy bleeding?
Yes, yes. So that's a part of it. That's definitely a part of it. It depends on where your fibroid is located.
Mm-hmm.
But during certain times of the cycle, especially when your period is going on and you're shedding that lining, yes, you will have heavy bleeding.
Okay. Well, fibroid, we know you better.
Yeah.
So, now, because we know and understand its makeup a lot better, how then, like Gladys mentioned the issue of the heavy periods, and we just talked about them. What are the other markers that women who probably have them or might need to go and be screened for them? What do they need to think through? What are the symptoms they need to look out for so that they know what it could be?
So it
Essentially.
varies from person to person, and it also depends on the location. So you could have a
Mhm.
woman. Actually, I was speaking with a woman not long ago who didn't even know she had fibroids. She knew she couldn't get pregnant, and they did some scans. She's in a different state. She's here in the United States. She's in a different state, so I wasn't involved in all of that. She just came to me for help. and she wasn't told she had fibroids or anything. But then I asked for her scans because she wanted to work with me. And then in there, she had fibroids, but she had absolutely no idea. And so I was thinking that the location of those fibroids are what could maybe have been causing the problem. But in her case, she had 2 fibroids and she had no idea. She just was struggling to conceive. Now, I'm not going to say that if you're struggling to conceive, then you have fibroids, because actually most women can conceive just fine. The greater percentage of women who have fibroids can have babies, they can conceive just fine. But if you're struggling to conceive, you can consider that maybe as an option. So Gladys said that she had heavy bleeding during her menstrual cycle. So if you have to change your pad out every hour or less, or even every 2 hours, that's on the heavier side. That doesn't mean you have fibroids, but that just means that you can consider maybe getting checked for that. If you're having really bad period pains, then I would consider, some women will say they have throbbing pain. Some people, it's just a miserable period. It could be a number of other things. It could be endometriosis. It could be a lot of different things, but you might want to at least look into fibroids. Another thing is if you have heavy bloating, you'll feel like, your stomach is just supposed to be flat. Even if there's fat there, then that's fine. Having fat in your stomach is one thing. But if it's bloated and it just protrudes out and it's like hard as a rock whenever you are touching your stomach, then that's some cause, some way indicator that you may have fibroids. I know another one that I like to tell women here in the United States. I don't know what's wrong with the dairy here in the United States, but a lot of women with fibroids, whenever they have dairy, any cheese, milk, things like that, they have some kind of feeling down there. And so that's an indicator that they probably might have fibroids. Those fibroids are like reacting to that dairy.
Yeah.
But overall, if there's any uncomfortability down there, then you can look into maybe maybe there's something. You shouldn't feel anything down there. It should just be normal. But if you're feeling throbbing or you're feeling anything, then you should just go get checked for it. Again, it could be a number of other different things, but I would just make it known to your doctor that you're having this particular thing. Then they can scan. Endometriosis is another thing that is sometimes similar to fibroids. So at least if they can rule those 2 out, then that's better.
Okay. All right. That's interesting. That's very, very interesting. And it's getting me thinking. So you said that there was a woman who came and who was struggling to conceive, and Gladys also mentioned the same thing. How then do they impair the conception process? Like the reproductive system, what's their impact?
Okay, so I don't like to go into fancy medical jargon when I'm talking, just because most people don't care. But
We'll lose
there are
you.
different types of fibroids that are all throughout. So Gladys had a number that they couldn't even count all of them. They didn't even get to count all. She had a lot of them. So this lets me know that she probably has some that were inhibiting her to conceive. What that means is our uterus is kind of like a triangle. So you have this going up and then it goes down like a triangle. So at the bottom tip where it kind of goes into a triangle, when the egg is fertilized by the sperm and you're going to get pregnant, that fertilized egg is going to implant into the cervix. But if there's a big fibroid there, and there are two sides. So if you have fibroids on both sides of the cervix, then it's impossible for implantation to occur. So I'm thinking in Gladys's case, she was actually able to conceive. So maybe she just had one on one side. And then whenever the egg tried to implant into that one side, she was unable to conceive. Most people don't have that type of fibroid. So most people will have like 1 or 2 or 3, but they usually aren't in that area where the cervix is. Usually they're on the top or they're on the outer parts, or they are on maybe like the top right or left. But for them to actually be in the cervix, a very small percentage of women have the fibroid in the cervix. But if you do, then it inhibit your ability to conceive. But it's okay if they're just on one side, then at least you can get implantation on the other side. It'll just maybe take a little longer to conceive. But if you have fibroids on both sides, then conception is going to be almost impossible.
Wow. Okay, so that's how they affect conceiving. How about the course of the pregnancy? Because she talked about losing some babies as well in the process, and probably even when it comes to delivering babies.
There are a number of reasons why it's not conducive to get pregnant when you have fibroids. Number one, I talked about the blood vessels and the nutrients. If you've got multiple fibroids in the uterus, they're sucking all the energy. I mean, even as yourself, even not being pregnant, if you're just having a bunch of blood going down there, then even your mind will get a little foggy. You'll be tired yourself. And so now when you're putting a baby itself is draining getting all the blood. It's sucking the life out of you, like I like to say. And so if it's there along with fibroids, it's too much for your body to just take all that blood from your brain, from everywhere down there. And so then the body has to abort the baby because they can't abort the fibroid. So it has to kind of choose and say like, okay, I'm not able to handle these fibroids and this baby. Another reason why is when we have a baby, that baby occupies a big part of the uterus. And so if that baby's running into fibroids, your body's smart. Your body knows when it's unhealthy for the baby. So as soon as from the moment that you get pregnant, being a mommy starts. You're already trying to protect that baby. And so as that baby is growing and it's running into and bumping into the fibroids, then your body's saying, oh, this isn't healthy for the baby because there's other things going on. The baby won't be able to grow really well. And the uterus has to expand, but it can't expand anymore to a certain point because there are these fibroids that have these structural proteins, these collagens and other proteins like that. So there's an inability for the embryo to actually get bigger, for the fetus to get bigger. Another reason is just simply because those fibroids are sucking the hormones. They're sucking the estrogen. There's just too much hormonal activity going on there within the fibroids. And so that inhibits your body's ability to give proper hormones to the production of the baby. So there's a number of different things going on. If a woman has this one fibroid, depending on the size, they could be fine. Some women don't have any fibroids, but then they develop the fibroids when they get pregnant. And they can have pregnancies just fine. The problem now is once you start to have a bunch of fibroids, especially if there's small fibroids everywhere, those are the ones that are really using the hormones. And so that becomes a big problem.
Wow. Okay. So I was having a conversation like when I was preparing for this conversation. So I talked to a couple of people, and a friend was actually telling me she had a fibroid, and her doctor was recommending a C-section because it was basically competing for the opening for where the baby would come out, and but she delivered vaginally. So essentially, what other circumstances can lead to a different type of birthing experience when it comes to fibroids?
So like I said, when you're pregnant, the body cares about the baby. It's prioritizing a healthy baby. So that's why we have low cases of like babies that come out with problems, just because our bodies as women are so good at protecting the baby and realizing, okay, if this baby isn't in a healthy environment, let's hurry up and get this baby out if this baby's strong enough, or let's just abort let's stop the production of this fetus if it's unhealthy for the baby. So there is, number one, you may just go to labor early, before term. So that is one concern. Your body would just say, "Oh, let me get this baby out right now," just because if this baby grows another half a pound, I don't even remember kgs anymore. um, so if this baby grows any bigger, we're gonna have an issue, or there's no longer any more hormonal capacity for this baby. So
Mhm.
number one is early deliveries. Then, of course, we have, depending on the location of the fibroid, there could be an issue with delivery, just like you said. So they may have to remove the baby by a C-section just because there is a fibroid that's inhibiting the exit of the baby. Those are the two most common issues. Sometimes we'll see that women that have fibroids will have pregnancy complications. So they'll have weakness in their uterus, weakness in their cervix. Gladys had a similar situation to that.
Mm.
So it's just too heavy. So it's carrying these fibroids and then it's carrying a baby. And so that's
Yeah.
too heavy. And so sometimes you have to go in and just get some sewing and stitching of that cervix. There are just so many complications that could go on as a result of too many fibroids. But if you just have one, sometimes two, then you could be fine, especially if it's a bigger one. So the bigger ones are better than the small. The smaller ones are the ones that are still using hormones. But then if you have a bigger one, it won't be using as many hormones. So you can get pregnant fine. You can have a normal vaginal delivery.
Okay.
While you're
Wow.
on
Okay.
this,
So,
I
sorry,
was
Gladys.
gonna. No, while you're on this, you said something about the space in the uterus because I remember when I was pregnant with my son, I had one really big one on one side of the uterus. So actually, my son had to share space with this big thing inside. So when he came out, I remember he ended up having what they call is a club foot because he didn't have enough space in the uterus. So he had to sort of fold himself a little bit, much more than the regular baby. And so that I think that's the one thing that I hadn't mentioned about my story that, because it's not just me, it could also affect the baby itself. And then, of course, that's something that could be corrected. But I think a lot of people might not understand that that also is a factor that could affect the baby also as well. So, yeah, just that.
Yeah. I did want to say the type of fibroid. It's an intramural fibroid. That's the one that is in the cervix. So if you've been told that you have that intramural fibroid, then that's the one that can potentially um, make you unable to conceive. But a small amount of women, I mean, less than 10% of women have that type of fibroid. And then if you have it on both sides, that's when it's a bigger issue. But if you just have it on one, you can still get pregnant on the other side of the cervix.
Good to know. Oh wow. So I wanted to just be clear and find out, like, maybe I could just ask about, because I know I only found out that the fibroids reoccurred because I had gone in with a problem, but like now I'm fine and I'm hoping to get pregnant again in the future. So I want to know, like, generally, when would you say they might just reoccur? Like after how long a time would I?
I have no, it depends on the woman. Some women I mean, within the year, they've already started
Mm,
growing back. Um, yeah,
okay.
it depends on your body and why
Okay.
and kind of why they were developing in the first place, your diet, things like that. It's possible to stop them from coming back again. So I always tell women, if you are just going to just get surgery, that's not ensuring that they don't come back. So it would take working one-on-one with someone like me to kind of come up with a game plan. Maybe in your local area, you can find a naturopathic physician, or maybe there's
Mm.
a physician that will work with you one-on-one on this. So there needs to be a plan when you get surgery for you not to have them grow back. So there are
Yeah.
women, for example, I have women that come to me all the time and they say, "Hey, I have surgery in, 1 month to get them removed. I'm having my myomectomy, and then I don't want them to grow back." So then we'll start coming up with a plan so that they don't grow back. But just going to go get surgery doesn't mean they're going to stop. Surgery doesn't
Mhm.
stop them from growing. Surgery is just like, um, like with your hair, whenever you trim your hair, it starts growing even longer. So it's just like, okay, this is just making space for something to grow back. or even when you prune your roses, or whatever, mow your
They come
lawn.
out better.
Right. So it just it doesn't stop anything at all. You're just basically removing it so that the ones that are kind of left there, it doesn't fix the problem, basically.
Yeah. Okay. Yeah. So I was actually going to ask that. Is there a way of somewhat reducing the growth rate or preventing them from growing back? So can you actually, like, if you've got them, reduce the growth rate and possibly even shrink them so that they can disappear? Is it possible?
Yes, it is. Yes, it is. I've actually worked with people to do that. It's definitely possible. It takes some discipline, dietary modifications, and this is all customized to each person, not from one person to the next. Everyone has different fibroids. Everyone has different situations. So it is possible to shrink the fibroids. There are lots of cases of it. I know people I have clients that I've been patients that I've worked with to do that. It's possible. It takes discipline and it takes a long time, but it's possible. It's not a 1 month or 2 month thing. It takes several months to years to shrink them, and it's just shrinking slowly but naturally.
Okay.
There's no
So
pharmaceutical that is that can be prescribed that will shrink, that's safe, that will shrink fibroids. But there are natural methods of dietary changes, lifestyle modifications,
okay.
some herbal medicine, plants, things like that.
Yeah, I was going to say that someone has to completely modify their lifestyle, like everything that they do, because once you stop, you can create the environment within which they can grow back again, right?
Right. Yeah. And it takes a certain kind of person to be disciplined like that.
Yeah.
Of course, if the person only had one fibroid, then it's easier. But if the person has had multiple fibroids, then there are certain things that, things that you put down here, like herbs that you can take, and then you put them on top of the area, like in your pelvic area, things that you drink, foods to avoid, things like that.
Okay. Thank you so much, Dr. Vita. This has been like so elaborate and so eye-opening. As probably we're tapering off, I want to find out, is it possible that these fibroids can become cancerous? Because I can imagine you're growing a mass, and we know that masses equals tumors equals people's thoughts about cancers and things like that. Is there that possibility?
So I only have data for here in the United States where I live. And the
Mm-hmm.
data tells us that less than 1 in 1,000 people will actually have their fibroid become cancerous. So the likelihood of that is no. More than likely, it will not become cancerous, especially if they get really big. If it's already big, then it's not going to become cancerous. So I wouldn't worry about that.
Okay.
Unless
Awesome.
you're that 1 out of 1,000. It's less than 1 out of 1,000. So it's very rare.
Yeah. Okay. At least that's comforting, right?
Yeah. Yeah. It's just a benign ball of tissues.
Yeah, definitely. So, probably my last question would be, as you are going through this process, like Gladys told us, she was getting mental health issues. She wasn't okay, you know, and we know that the body functions with hormones, as we're saying. These things come from hormones. Does that state of mind also then exacerbate the problem? I mean, how do the two relate, if at all they relate?
Yeah. No. There's no doubt a mental health connection here. Not
Mm-hmm.
just from like the hormonal standpoint, but from quality of life.
Mm-hmm.
So you need proper blood flow going throughout your body for you to have good health. And so if you have this ball that's taking all your energy away from properly thinking, that's, think about when you're pregnant, for those women that are watching that have been pregnant before. This baby is occupying so much of your energy that at sometimes you could your brain, you're not thinking clearly. You're hormonal, you're emotional, a little extra emotional. And so it's the same thing with these fibroids. This is a hormonal, think of it like a little baby that's growing.
Yeah.
And so it's will have you off balance. There's an imbalance there of your hormones. And so because they're there, you also have an increase in the amount of hormones in your body. And so that definitely plays a role. But aside from that, if you have a woman that's bleeding so much during her period, that leads to you having anemia. And so that is a problem in and of itself. And so, of course, you may have to be on iron tablets or, eat extra certain foods. But for a woman to bleed so much and you're always changing your pad, you're always changing your tampon, that it doesn't seem like it's a big deal, but your quality of life is affected by that. You cannot just have a normal day. You cannot just go to the grocery store. You cannot just do the things that you normally do. And so there's a mental health connection there. The extra bloating, that is the bloating that women with fibroids get is terrible. It messes with your quality of life. It messes with your confidence. It causes a mental health issue. The pain that you'll get during your periods, or just even outside of your periods, you'll get pain down there. That also messes with your mental health. So this is a mental health issue 100%, not just because of the extra hormones that you're having, the reduced blood flow, but also the quality of life. It messes with your quality of life. You can't do things like you used to do. You can't eat foods that you used to eat. And so this is definitely something that affects women's mental health. It's even deeper from that, the woman that can't conceive. As a woman, that is painful to be in that position where your ability to conceive is being affected. And sometimes you don't know whether or not it's actually the fibroids or not. But I know from experience that whenever you cannot conceive, that messes with your mental health. That even if it's you tried just 1 month, that messes with you. More or less the women that try for years. You can't focus on anything. That's all you're thinking about is trying to have this baby. So yes, fibroids all across the board cause mental health issues. Well,
But anyway, I like you mentioned a couple of things about how it affects your life. Like for me, I think one of the things that used to really stress me is you can't have a peaceful night with your partner next to you because you don't know when next you're going to spoil the bed. So waking up, I think I used to wake up when I'm on my period. I would wake up probably 4 or 5 times more than the usual to just make sure that I go clean up and bathing more than the usual, and that's stressful. And you can't have white linen because you don't know if you have that little accident, then it's a whole mess. So, and also I think the other thing is you can't wear the things that you want to wear because, like you were saying, the bloating is really bad, and then it bulges as well. Like I really have people always say, how come you don't have a flat stomach from an early age? And I didn't know that I couldn't have a flat stomach because these things were really big, and my belly is always big, so I would always have to wear clothes that are not like body fitting or anything like that, which as a woman it does affect you. And I mean, frankly, I also want to put on a nice bodycon dress, but I can't do that on the most part because I've got this big belly. So yeah, mental health, big tick.
yeah.
I
Thank
totally
you for
understand
sharing
that.
that story. Yeah, that's painful. That is definitely painful to hear another woman go through things like that. So hopefully we can come up with some good therapeutics to help women with this. The only solution just can't be surgery. And so it's
Mhm.
expensive to work with somebody one-on-one. Not everyone has the means to do that. So hopefully things can get better.
One last question before we go. Thank you. Definitely. I'm thanking everybody. Any parting words, Dr. Vita?
Well, I want women to know, first off, I'm a resource for you. So make sure that you are connected to my social media platforms. I try my best to answer questions. If it's too personalized, too one-on-one, you will have to book a call with me. But if you have general questions, at least I can point you to a resource, point you to a video. I have free ebooks. Maybe I can point you to one of those. So I want you to be educated. Don't think that any topic is too big for you to understand. So don't just go to the doctor and just not ask questions. I want you to know everything that's going on in your body. I want you to advocate for your own health. So ask them specifically. Some doctors just are too busy, or they think that it's too hard to explain things. But whenever you go into the doctor's office, whenever you're given a diagnosis, try to really understand what's going on. And then if there's anything that you cannot understand, contact me. I have a YouTube channel that has lots of videos that will help explain certain things. Or if I don't have a video on it, just contact me anywhere on social media. So just be an advocate of your own health. That's my parting paragraph.
No, thank you so much. I want to thank you both so much for taking the time to come here. Gladys, to share your story, Dr. Vita, to share your expertise. This has been absolutely phenomenal, absolutely amazing. And yes, I agree that Dr. Vita's got lots of good stuff on her social media platforms. I think I even shared one of her lives on menstrual health. I mean, simple things like period. Do you know what your period means? So we're probably going to have more discussions around different subject matters to help educate women and even their spouses, because you don't know what's going on with her. So you need someone to be able to explain that this is what's up. So thank you two ladies. You were phenomenal, and looking forward to seeing you again on this platform.
I'll be back.
Awesome.
All right, bye.